Hi friends, I am Dr. Jayanti Kamat, IVF consultant, obstetrician and gynecologist practicing at Srishti Fertility Care Center and Women's Clinic, Andheri, Mumbai. So today we will be talking about a very common topic, that is premenstrual syndrome or PMS. I am sure all of you must have heard about it. So today we will be talking as to what exactly is PMS, why does it occur, and how you can deal with it. Premenstrual syndrome is nothing but a group of discomforts or symptoms which a woman experiences just before her menses. Now, what are these symptoms? These symptoms can be physical symptoms such as headache, tiredness, bloating, slight abdominal pain, heaviness in the breast, leg cramps. It can also have certain emotional symptoms such as anxiety, depression, mood swings, irritability, sleeplessness. So these are all the symptoms. What is the cause of this premenstrual syndrome? The exact cause is still not known, but different theories have been postulated. Some people feel there are two main hormones in a female, that is the estrogen and the progesterone. So these two hormones have to work in perfect balance for a healthy woman. So whenever there is an imbalance between these two hormones, that is the progesterone and the estrogen, PMS occurs. Another theory is there are certain neurotransmitters in our body. Neurotransmitters are the substances which allow messages to be passed on from one nerve cell to the other. Now these neurotransmitters and these hormones have a relation with each other. They have to work in coordination with each other. So when this coordination is lost, PMS can occur. As we all know, estrogen and progesterone, the level in a woman's body does not remain the same. It varies according to different stages of the menstrual cycle. How many women experience PMS? Nearly 40 to 60% of women have experienced PMS at some time in their life. So what are some of the risk factors? One is age. PMS can also occur at extremes of age. A teenager may experience it, or a woman who is in her 30s or 40s may suddenly experience PMS. So, and as a woman grows older, the PMS symptoms keep on increasing. Second is heredity. If a mother has PMS, there are more chances of the daughter having PMS. Then there are certain environmental factors like disappointment in a relationship, loss of parents, loss of job. So all these things also can trigger PMS. Or if the person is initially suffering from some mental disorder like anxiety or depression, so she has more chances of developing PMS. Now, how do we take care of this PMS? Some women have very mild symptoms. They can manage it on their own and it just passes away once she starts her menses. In some women, the problem becomes so severe that she cannot concentrate on a career. She becomes very irritable. It becomes very difficult for even the people around her to work with her or to be with her. So the range of PMS symptoms vary from mild to severe. Now, what are the treatment options? Treatment options mainly revolve around diet, exercise, lifestyle factors, sleep, and reducing the stress levels. Now, diet. A diet which is very high in salt and sugar will definitely trigger PMS. Some women have very irregular eating habits, lot of junk food, lot of packaged food. So this can trigger PMS. So in order to avoid PMS, a girl should eat at regular intervals, keep herself hydrated and avoid junk food. Second, exercise. Exercise has many benefits. So, exercise releases certain hormones in the body which are called as endorphins. Now, these endorphins are the feel-good hormones, and this is very good for mental relaxation and to maintain a healthy body. There are some women who tell me that doctor, I do not get time to exercise. I go out to work, I come home late. Exercise does not mean that you have to necessarily join a gym. You can just go for a brisk walk of 45 minutes at least 4 to 5 days a week. This exercise will help you to tone your body, to reduce weight if you are overweight. It will help you to help your digestive system, and also it will help you to sleep better. So exercise is very important, and many women who exercise regularly or who have started exercising regularly have got rid of their PMS symptoms. There's another notion that since I have PMS, I have to slow down all my activity before I get menses. No, it is not right. Actually, if you exercise or have an intensive workout just before your menses, most of your PMS symptoms will go away. Third is sleep. Sleep is very important for the body. A person requires about 8 to 10 hours of uninterrupted sleep. But in today's world, people are so hooked on to their digital devices, they lose an account of time, and invariably they sleep later. And when the sleep duration is shortened, the body does not get rejuvenated enough, and this can cause a lot of hormonal problems and various diseases as well. Now, before we label a person as PMS, there are certain tests which have to be done. There are no specific tests for PMS as such, but there are certain tests like thyroid and diabetes. These diseases have to be ruled out before we label a patient as PMS. Then what can the person do? What can the woman do? The woman should keep a regular track of a menstrual calendar. How many days she is bleeding, when her menses has started, when it has ended, when the symptoms have started, how many days prior to her menses her symptoms usually start, what is the severity of these symptoms. So she has to document all these things at least for a period of 3 to 4 months. Then there are certain mental problems what a woman has, like as I said, irritability, depression, anxiety. So even for these problems, exercise helps, and she can try meditation and yoga, which reduces her stress levels, especially certain breathing practices like pranayama can also help in reducing stress. When all this cannot be managed on your own, please seek professional help. You can consult a gynecologist, or if you have a lot of emotional and mental issues, you can consult a counselor or a mental disease professional. It is not a matter of shame to take professional help. When you go to there are certain supplements which help in curing this PMS, like evening primrose oil, vitamin supplements, and diet which is rich in proteins. If you have any queries on PMS or any other menstrual problem, you can contact me on lybrate.com. Thank you.